it is Wednesday, October sixth, 2023 at 6 o'clock. I'm calling the Board of Health.
October 4?
Huh?
October 4?
Oh, jeez. I need to put my glasses on. October 4th, 2023 at 6 p.m. I'm calling the Board of Health meeting to order. Is anyone recording this meeting? And I see no one. And LakeCAM is recording this meeting. First on the agenda is 6 Beechwood Drive. Meet with Outback Engineering to discuss requested local upgrade approvals. Turn it over to you.
How you doing? Jason Youngquist from Outback Engineering. I'm here with the builder. This is the burned out house on 6 Beach Street Drive. Burned down, when did that burn? February.
I think February 8th or something.
So the house has to get restored back to livable, and in the meantime, there has a cesspool that's, pretty much sitting in the water table. So we have to replace that, and we're putting in we're proposing to have a tight tank, 3,500 gallon tight tank. Being that close to the pond, all the wells around there, there's really not much more you can do. It's sitting in front of the house, the driveway's there, you can't have a big mounted system sitting there. Tight tank seems to be the only way to go. We have conservation next week, just because we're within the buffer zone to the pond. The well's out back behind the house, and that's about it. We dug
I'm fine with a tight tank, because nothing goes in the ground, but I just wanted to make sure, I didn't know if you're aware, because it's happened over the years. In a fire like that, if you could find some septic to put there, but it's just too expensive to do, there's something in a lot of the policies that covers that, because they make you upgrade when it's that big of a thing.
Yeah.
So I'm just,
She was underinsured.
oh,
She bare minimum on
Okay.
everything, so,
yeah.
yeah, we're
Again-
basically in there at cost,
Yeah.
doing everything that we can for them.
Again, a tight tank, nothing goes in the ground, so I don't have a problem, but I just didn't know if cost was an issue. Sometimes people don't know that. If you push the insurance company hard enough, they'll pay to upgrade it.
Oh.
If there was any damage to the system from a fire truck too,
Yeah.
you're driving over it or something like that.
Even if it's not, there's, when you do that much of a house over, there's a clause in there that says, now you gotta bring everything up to code.
Yeah,
And,
we have the house right down to the foundation,
yeah,
and we pushed them, and we just got enough out of them to, put the structure back.
okay.
And she is aware that the tight tank's gonna have to be pumped.
Yeah.
And it's only her and her husband.
Okay.
So she says, we know we're gonna have to pump it every 2-3 months. She says, we're pumping the cesspool now every other month. So,
Again, I'm fine with it, but if that was a consideration, the cost, I just didn't know if she looked into that, because,
yeah,
if you wanted something saying we'd rather have it upgraded.
Yeah.
But if she doesn't have the insurance for it, then she
Doesn't
doesn't have
have
the
it.
insurance.
wish she did.
Yeah. There's really nothing else to do.
Where's the driveway in relation to this?
So this is actually, the plan that we'd submitted to the board didn't have the driveway on it, so we revised the plan for conservation, because they wanted some notes on there about be loamed and seeded area that's been disturbed, so we added the driveway on there. So I brought some revised copies that show the driveway, and it's this gravel drive right in front.
Yeah.
So we have an H20 tank that's
Okay.
coming in. So I brought revised plans showing the driveway and the changes conservation wanted.
Okay.
Okay. Yeah, I didn't have anything more. What you, Derek?
No, I didn't see, so this is year round, obviously.
Yeah.
Not a seasonal or anything. The boots a foot above the water table. 3,500, so you can't do monolithic. I don't believe they make 35s
Not
monolithic,
at 35,
correct?
no.
So you do them there, you're gonna have a seam.
Yep.
Boots and seal with hydraulic cement. Yeah, I mean, if that's what they wanna do, I mean, I'm fine, and I think even in the future, if they wanted something, one of these new treatments or something came out and they wanted to put something in,
Yeah.
we've allowed it, so it's not like you're
Yeah, they've got the
doomed for a tight
perfect
tank
septic
forever.
tank for 'em.
We've had other
Yeah.
people come in and wanna put a system in later, so. But
Yeah.
I wouldn't deny it.
And the tank can fit treatment in it,
Yeah.
and then put other stuff off of it, right?
Yeah, you can, there's a lot of new stuff coming out, so.
Yeah. Well, I noticed the guy 2 doors over, He's got a nice little raised area,
Yeah,
and he was talking to me, he says, yeah, he says, that's my $50,000 system.
yeah.
Right.
Yeah, it's just recirculating sand filters, give you a small footprint,
Yeah.
it's still sticking up, cause you know, you can't get the separation of groundwater and
Yeah.
stuff, cause of the pond and everything, but, you know, still gonna be sticking up right in the middle of the driveway and everything, so.
Yes. So, I'm fine with it, and we didn't have to notify any abutters? Or
Nobody was
just,
affected, no,
no abutters affected?
just a waiver for the pond.
Just New Bedford and,
Taunton.
Ed, do you have anything to add?
I did look at the well, when we were doing the park, and it is pretty far away and everything, but still, with a fire like that, you wanna test that well.
Yep.
So I would highly recommend
Yeah,
it. You
yeah.
test-
We planned on pumping it off and testing it,
Okay.
so.
Anyone else wanna speak to this? I don't see anyone. I'm good.
I'll make a motion, we approve the local upgrade of a reduction of the required setback between the proposed tight tank and surface water supply from 100 to 95 feet per 310 CMR, but I think that's supposed to be 400. Ed, did
Yeah,
you say?
400.
Yeah, so this is wrong, right? So I'll amend that to 400 to 95.
Second?
Any more discussion? All those in favor?
Aye.
Aye. Thank you, gentlemen.
Thank you,
Cheers.
I'll leave these with you.
Thank you, gentlemen. Have a good night.
Alright, next on the agenda is recommend to select board to appoint Gabby Almeida and Shaylin Rodriguez as our new shared services health specialists for the period of November 1st, 2023 through October 31st, 2024. You have anything to add to this, Ed?
Yeah, so I think you guys knew we were part of every town in Massachusetts is now part of a collaborative. It's what they did. They had a lot of, I think they just got a lot of money from COVID, and they made all the towns join, and we're in a group with the 6 other towns, and what they do is they hire personnel for that group, and we get to share them. So there are these 2 inspectors, they do both food inspections and Title V. They're not a lot of experience in Title V right now, but we're kind of working with them, we're getting them up to speed. And they're supposed to cover for us and stuff like that, like say if I'm on vacation or something like that, or we need a last minute food inspection, they're there to cover us. But to do so, you guys, well, they have to get appointed by the select board, but prior to that, they would have to be appointed by you if they're gonna represent the town. So, like I said, you would have to recommend them, and it's, all the other towns are doing it. It's Westport, Rochester, Freetown, Mattapoisett, and Marion are all in the group, and they'll be shared between all those towns.
Now, do we have to pay for their services when we do have them?
Completely free. State pays everything.
State pays.
So the state pays their salaries, and, we get other stuff. They pay for trainings and stuff too. And then, we just use them. That's the idea. We can't buy actual capital things, but it's mainly for human resources, because they want to give us, because a lot of the small towns like a Rochester or something like that, Rochester has like 1 part-time employee, and they really just can't cover everything. So it's mainly for the smaller towns, but it helps out us too. It just covers like all the gaps and stuff that, where like someone's not there or something like that.
Right. I loved when this idea of the collaborative came up. Remember the conference we went to, and they gave us that list of all the things that could possibly fall under the Board of Health's jurisdiction. But there was no way we're gonna have a separate person for every single one of the things on there. So now you have like a collective where they'll have one person that can service all these towns, that can do all these little things. If we have one apartment that needs to be inspected within those apartment specialists or something like that. It's kind
Yeah,
of a
and
cool
that's
thing.
just it. So some are strong in housing, some are strong in, food, and that's where you can kind of pick and choose too.
Oh, about 10 years ago, the state had money but then none of the other towns wanted to do it, but Jean Spalding was still on back then. And I worked with her, and yeah, it's like you go to a city and they got 5 guys, and one knows apartments, one knows,
Specialist.
one knows restaurants, one knows, right? You come to a
Health.
town though, and you're supposed to know everything, and nobody really does. And they were all afraid, though the other towns, when push came to shove, they didn't want to give up their authority to, you know what I mean? A lot of them didn't want to give up their power, because I was like, I don't care who does the restaurants, you know what I mean? Like, because
Especially if they're offering and. it
Yeah.
doesn't,
Yeah, as long as it's
charge to the
done
town.
correctly and,
Yeah.
you know, it's done. That's the important
Yeah,
part.
but the state tried then to group it all together. They tried a long time, a couple of years, and the towns had to sign on to it, so now that they have so much money, they just did it with their money.
Yeah.
And watch, in 5 years, they'll tell us we all gotta start paying for it ourselves and they'll back out of it, but take it while we can get it.
Yeah, I'm for it. I don't have any problem with it.
Yeah.
It can only help.
Alright, then I'll make a motion that we, oh, sorry, did you guys wanna say anything? I'll make a motion, to recommend to the Board of Selectmen to appoint Gabby Almeida and Shaylin Rodriguez as our new shared services health specialists for the period of November 1st, 2023 to October 31st, 2024.
Second?
Any more discussion? All those in favor?
Aye.
Aye.
Aye. Next on the agenda is discuss recent Board of Health agents pending items. Ed,
What happened to go over this?
thinking that's either gonna be in this or with the public hearing.
Oh, okay,
Yeah, the pending item, I guess, would be the regulations.
okay.
I don't think we have any other pending items. Unless there's something
Yeah,
you-
we got other stuff, like,
We do?
well, like, AAA and stuff like
Oh,
that.
okay.
Those,
I mean, you can do the AAA first if you want, or I thought you wanted
Do all the quickies first.
AAA.
Sure.
So now they've tested 26 mosquitoes for AAA, the closest one being in Rainham, so it's now getting close to us. It was kind of just in southern Worcester County and Hampden County, so it wasn't really in our area, but now it's definitely getting in our area. Hopefully in the next 2 weeks or so, we get a frost. It's usually in October, but given the weather today, it's really kind of tough to tell when it's gonna come. But it is starting to increase. There are no human cases of AAA. There's been 3 human cases of West Nile, but West Nile is a lot less deadly. So we're I guess is less of a concern about that. But AAA's it's 50% mortality rate, so 50% of people who get it die, and the other 50% usually have long-term consequences. So it's fortunately we haven't had any last year, and hopefully we get through this year without some. So, but definitely, since it is in our area now, just take extra precautions with mosquitoes and, repellent and all that stuff.
And then on this rate change, because this is like way more than what we always do, I'm pretty sure we continue this. So I don't know if it needed to be on the agenda officially. So I just wanna make sure that if it did, we just put it back on in 2 weeks and re-vote. I'm fine with all the changes. I just know that this stuff gets into the weeds, and if you don't do it perfectly, that it gets kicked back and we spent a ton of money for nothing. Like I said, I thought we continued it until the next meeting after Copeland and Page reviewed it.
we did, that was.
Yeah, so then it should have been a item, I think, right? Something that's
I
continued.
think what happened is, Copeland and Page didn't review it till this morning.
Yeah.
We just got it today.
Oh, I'm not blaming you.
Yeah.
I'm just saying these things, if you
No,
don't do
you're right.
exactly to the letter of the
Yeah.
law, then we spent the money, we advertised, we have a whole hearing, and then it gets kicked back, and we gotta start all over again.
Okay.
So if that's the case, we can put it on the next meeting also, but
Well,
I
the
read
next
through it and I'm okay with it.
problem is the next meeting is our public hearing. We've already posted for.
So you
folks.
think it needs to be an agenda item, a specific agenda item?
I don't know. I just think we should check. We continued it, and usually when we continue something, it's on the agenda.
We did continue until we had, but again, like you
Continue,
said, we
yeah.
just got that
We
today, so
continue
we
the
really
Discussion?
didn't.
Trying to think of what we continued. Was it just discussion or was it?
I mean, I just wanna make sure we do it right, or else we're gonna have that whole hearing for nothing.
Well, we are announcing the public hearing, right? So we could vote on it as part of the public hearing announcement,
Yeah,
so that we're good with it, and then it's going forward to the public hearing, and then that'll be open for public comment.
yeah.
It should cover all the bases, I
Yeah.
think.
Well, I'm just saying we should just check tomorrow,
Okay.
just to
I will.
make sure. Cause
Um,
these.
So we can't even discuss it then, really, because it's not on the agenda.
Well, we can, cause it's kinda old business. Oh, we don't have old business on there either, but, I mean, we can all discuss it and have it on the next meeting if,
I mean,
I mean,
as
if we
part of
had,
the-
if we had to
press
have a
release.
special meeting next Tuesday for 15 minutes to take another vote if we needed to do it, or, you know what I mean, a Wednesday, we could do it in 10 minutes, just have a quick meeting and,
Right, or even depending on what's on the regular agenda,
Yeah.
we could do the regular meeting. Oh, no, what's the time?
No, cause the hearing's first.
Is it? It does have it at 6, all
Yeah.
right. Yeah,
Yeah, so, and if it has to be posted, if there's gonna be any issue, then we just have a quick meeting. We can still discuss it.
and we posted at
And if
5:45.
there's any change,
Small meeting at 5:45,
if
the
there's any,
public hearing and
if
then
there's any
regular meeting.
changes we have to make, that if we have any issues tonight, then we have 2 drafts ready that night, and then we can just vote on the one we want. But I read through all this, and it was all fine with me, I had no problem with it.
Yeah, I read
I like
through
it
what
too.
came through today,
Yeah.
and I'm fine with like
I'm
you
good with
said,
it, too.
I just don't know, your point is.
Yeah, the
it's
town
on the-
council made a few changes, mostly legalese kinda stuff that, cause we pay them all that money, they gotta find something, so.
They have their own language.
It makes sense,
Oh, no, it did, yeah.
it did, I mean, after I read the 2 versions,
Yeah.
yeah,
There was one other typo that I noticed.
on the
What
new
is it?
draft or the old draft?
What does it say? It says at the last paragraph, for assessment, yes, for assessment will mostly likely not be granted a waiver.
Alright.
That's on the new draft, right?
So it just should be most likely.
Yeah, I don't have the old draft, I turned it over.
Yeah, I see what you're saying.
Yeah.
And then does this actually get posted in the paper? This does, right? Is that what we did with our last changes?
Usually we say, you know, if you wanna see it, it's at the
That's
Board of
what's-
Health or on our webpage, we'll post it on our webpage.
Okay, so this is what is actually in the paper.
Yep.
Cause this has to get posted for how many weeks? 4 weeks?
It's,
2 weeks.
2 consecutive, yeah. So it was posted, I think yesterday? Oh, anyways, it was already posted once, cause we had to post it before, today's meeting.
Okay.
If we're all good with it, except for mostly, why don't we just have Ed check tomorrow, and if we need to have another meeting, that's the one thing we can discuss.
Just to
Not at a
discuss
meeting,
this
Just to
and
discuss
have it done
when
ahead of time.
having another meeting, if we need to have another meeting, we can schedule it. That's one thing we can discuss, having another meeting, so.
Right,
Okay, I'm fine with that. Anytime
it works for me.
if we do
And,
need
and
to.
if we need it, we need it, if we don't, we just go right to the hearing at the next meeting.
Okay,
Does that work for everybody?
I think so.
fine with that.
All right, there was nothing else, Ed.
The,
Yeah,
well,
So we'll put this
the
on the website
announcements.
though, so people can read it?
Yeah.
Okay.
Well, the announcement on the animal inspections,
yes,
so we're gonna start the animal inspections from,
Yeah, but you were good with your pending items, right?
oh yeah, pending items, yeah, sorry.
So yeah, next on the agenda is announcements, 2022 yearly animal inspections. And, so was this in the paper too?
No, we're just
No.
doing it here.
So this is a press release for the town of Lakeville. The Board of Health would like to inform town residents that the yearly animal inspections will be proceeding and will be conducted by the Lakeville Animal Inspectors from now until the end of the year. And, thank you from your Board of Health. And, Jared Darling and Emma Darling are our animal inspectors. They'll be reaching out to everyone that, is due for their yearly animal inspections. Next on the agenda is the announcement of a public hearing. So this is a legal notice, it's been in the paper, this week, and it'll be next week, and is the announcement of a public hearing will be held by the Lakeville Board of Health at the Lakeville Police Station at 323 Bedford Street on October 18th, 2023 at 6 p.m. for proposed changes to Lakeville Board of Health regulation pertaining to subsurface disposal systems and water. The proposed changes to the regulations may be obtained online or from the Office of the Board of Health located at 241 Main Street, Lakeville, Mass. during the regular business hours. This is from Chairman Chris Spratt, Bob Palucci, Derek Maxim, your Lakeville Board of Health. And I think that's it for that, right? Or do we want to read the full regulation change?
Both pages on it?
Or,
We're posting it.
yeah, we're posting it, and we did put, say there is information available, right? If they want to look it up on the website.
Yep, I just asked him, he's gonna put it on tomorrow, so.
Okay.
And then depends on, if he calls
Right.
tomorrow and they say you guys are covered, then we'll just come to the hearing. If he says we're not, we'll just meet someday next week. We'll give the 48-hour posting, we'll come and we'll open it up, make sure we're good, and then just come to the hearing the next week.
So we have the public hearing, close the public hearing, go on to
And then
opening
we
our
can go on
regular
to our
meeting.
regular meeting, yeah. But if this has to be done properly, we need to do it before the hearing,
Okay.
just in case. If we gotta advertise it or do something, it has to be done before the hearing. Then we have the hearing, then we can close the hearing and then go to our regular meeting.
Okay.
Yeah, that's the thing on the agenda. Anyone got anything else?
Is there any, I know COVID ticked up a little bit, but any different?
Yeah, COVID, we go by hospitalizations now,
Correct.
it's really tough to follow how much is out there. So the hospitalizations have gone up, they kind of plateaued a little though, you know, so it's not, it kind of came up sharply and now it's kind of leveling off a little bit. There's still quite a few people in the hospital, but we're not really expecting the bigger surge till, usually, Halloween sets it off. There's a lot of Halloween parties and then you get Thanksgiving and then Christmas, so each one kind of just escalates a little more, so, right now it's not too bad compared to what we're expecting coming.
Okay. And we have no more tests available through the Board of Health, correct? Is that
We do have some tests, so if you need a test, you can call the Board of Health. We're not advertising it. We don't have a lot of tests, so we in past times, we got a lot of COVID tests, so we were able to give out a lot more. So we've been giving them to the COA and the fire department, things like that, but we don't have a huge amount. But like I said, if you really need a test and you don't have one, we can supply it.
And you said, the state was offering 4 of them still? Is that on our website?
Yeah, that's federal government. There's a link on our website. You can go on it and it takes you to a thing. You just punch in your address and they will send you 4 tests for each household. So.
Okay, just if everybody's. Okay, that's all I have.
That's good.
Yeah, good.
Motion to adjourn?
Second?
All in favor?
Aye.
Aye.
Aye.